Well, I've been in Mobile for many years. I was raised here, so I have a strong connection to Mobile, and I know this is where I want to be a professional and raise my family. I've been in a couple of groups, and I've worked at the university here. And I was attracted to Urology Associates because of the high level of organization and systems and just the way they serve their patients very efficiently. I think that system is fantastic. They're growing. They give patients very, very good access to care throughout the region here. And I'm excited to be a part of their program. I have a couple of different specialties here at Urology Associates. I like men's health issues, which has to do with urination, voiding, bladder control, sexual function, and just general quality of life for men, particularly for men who have been through prostate cancer or other cancer treatment, who've lost erectile function or who've lost control of their bladder and urinary function. I also have a particular interest in stone disease, kidney stones, etc., with an emphasis on stones that are way too large to pass and helping patients deal with that kind of situation. I try to treat all my patients like family, and I know that's an ambitious goal, and I usually take a little bit longer in rooms than I should with patients because of that goal, but I really do try to pass every patient decision through the filter of what would I do for myself, for my brother, for my wife, for my kids. And I think patients get that. I want my patients to leave the room understanding the plan and feeling like they were heard, listened to, and cared for. That's a great question. I've answered it a lot, and it has a lot to do with my father. He was a pediatric urologist. He cared for children and their urological issues, which is a very particular, very sensitive area. I grew up watching him serve his patients. I actually kind of decided in med school that I was not going to follow him. I didn't want to follow Dad. I had that ego about me. But soon I figured that it was the right thing for me. And I ruled out other surgical subspecialties one by one after rotating through. I knew I wanted to work with my hands, but I knew I wanted to do that in a way that was perhaps a little bit more lighthearted than some of the other subspecialties. Urologists have a great sense of humor. We all get along pretty well. And so I really enjoyed that part. And the system, kidneys, bladders, ureters, urine flow, the particular types of situations that are very potentially painful and also very personal for patients. So all those puzzle pieces came together because of Dad, because of the system, because of experience, and it just funneled down to urology. Urology is a chance to talk to someone about a health issue that can cause a lot of worry, anxiety, frustration. The urinary system is particularly sensitive. We also deal with some fertility issues, a lot of chronic problems, chronic stone formers, chronic erectile dysfunction, chronic urinary tract infections, these things. I feel like when I'm in a room with a patient discussing those things, it's a challenge and it's very fulfilling, and I feel like I can meet them there and I get a lot of professional gratification out of that. Yeah, within Urology Associates, we've got so many wonderful doctors that have all sorts of specialties and strengths. I would say if you have anything in the realm of kidneys, ureters, bladder, urinary system, reproductive system, and you're worried about it and you're just kind of hesitant to get in, there is somebody here for you, absolutely. We've got someone with a specialty to address your problem. We care about folks. We want to see you and learn about you. So don't hesitate, come on in.